remain. Senator Cassidy.
I'll defer to Dr. Marshall, who for the first time in 2 weeks is not wearing Kansas City Chief colors.
Well, thank you, Ranking Member and Chairman. I want to just remind folks that Kansas has 2 nationally ranked basketball teams in the top 10, and it's time to move on to basketball season. But I am honored to be here today to talk about an issue near and dear to my heart. This is the dream, the nightmare that I've lived the last 40 years of my life. There's been a physician shortage in rural America for at least 40 years. There's been a nursing shortage in rural America for at least 20 years. So the challenge before me as a person operating a private practice in rural America has been to recruit doctors, and then as running a hospital is recruiting nurses. Myself, I went back to rural America. One of the reasons was I had a scholarship, a state-sponsored tuition scholarship if I would go back to an underserved area. My partner was a recipient of a National Health Service Corps loan as well, and was able to repay it. So those are certainly, some of the things that are working. I want to talk about nursing shortage for just a second. 80% of the nurses could come from community colleges. Let me say that a different way. 80% of the jobs in healthcare could be done with community college nurses. Community colleges are the answer to the nursing shortage. Those folks are typically from a small town. They're going to go to that small town community college, are more likely to stay in that small town. Of all the students from my hometown that went off to the university medical school, I could maybe count on my hand the ones that came back. There was a 4-year program at Fort Hays, more of a rural community program. Those folks are more likely to stay back. But once those young nurses taste the life in the big city, they like it and they stay there. So as we think about going forward, I hope we can come back and talk to the community colleges, nursing programs a little bit more. What can we do to accentuate them? And the small colleges as well. There's quite a few small colleges with good 4-year programs as well. By the way, their student debt is maybe a fourth or a fifth of what a person coming to a university would be. I'll talk about physician shortage just for a second. We'll go on the other end of the spectrum. A lot of our physicians are leaving the market right now because of burnout. Issues like prior authorization, surprise billing. Our ER doctors have just been overworked and underpaid, if you will, but mostly they're burned out. They're getting burned out with the surprise billing issues, and just, frankly, just the COVID epidemic just overwhelmed the system, and those folks are leaving like we've never seen them before. Nurses, again, though we forced them to take a vaccine, some of them didn't like that, and certainly they were burned out as well. Anyone want to speak to burnout in the profession? Just want to go ahead.
I'll speak to it. Thank you for that question, Senator Marshall. Look, I think what sometimes we forget when we're not on the front lines of healthcare every day is that the pandemic for us, for many of us, we can go and turn off our TV and go back home or work from home or work from our offices, and we can get away from the pandemic. We can get away from those stressors. For those frontline nurses and those frontline physicians, they can never get away from the pandemic. It's day in, day out, and it takes a toll. It's an impact on ill people, death and dying, and it's been a marathon for them, not a sprint, and that marathon continues. I think we've got to work on ways that we can improve the working environment. And it's been a more violent working environment, as there's been more verbal and physical assaults on healthcare providers. To that end, I think at Ochsner, we've really taken the approach of, we have a wellness office. We provided a lot of wellness programs for our nurses and physicians. We also work with our state legislators in the state of Louisiana to make violence in the healthcare workplace a felony. And also training our workforce on de-escalation techniques. But we have to be proactive in this area. And then I think the other thing, and speaking with the nursing programs, is we got to develop innovative new ways to think of respite for our frontline nurses. So one of the things...
I'm sorry, I'm going to run out of time. Sorry. So those are... I'm going to quickly talk, though, about residency programs. Where Kansas loses our doctors and our medical students is residency programs. We don't have specifically enough primary care doctor slots. And one of the challenges I see is that orthopedic residencies are a moneymaker for hospitals. So the hospitals are willing to fund them, but primary care is not a moneymaker for hospitals, and consequently they don't want to fund them. They want more government funding. So I'm sorry I'm over time. Quickly address just how a big medical center hospitals look at primary care residencies as opposed to, say, a specialty that residency that makes money.
Well, primary care doctors are essential for any large health system, and especially a group practice integrated health system like ours. Primary care doctors are key. So we value them as much as we value our orthopedists. And as Senator Sanders already mentioned, I think being able to fund community-based clinic primary care, to expand our funding for primary care residencies, we'd be very excited about that.
Thank you. I yield back.